According to a recent heart health survey by the Cleveland Clinic, Americans are still confused about the exercise recommendations for a healthy heart. And since it is Heart Health Month, now is the perfect time for a refresher course. Dr. Gordon Blackburn, Program Director of Cardiac Rehab for the Cleveland Clinic, joins me now with some potentially life-saving information. So thanks for being with us today, Dr. Blackburn.
Good morning, Robin.
So let's talk about exercise, because why is it that that is so important for heart health?
Well, exercise is beneficial for heart health, both from preventing the development of heart disease, but also for reducing the risk from death if you have heart disease. We can see about a 30 to 50% reduction in mortality for individuals who have had bypass surgery, heart attacks, or have had angioplasty or stents.
Now, I find this statistic shocking. According to that survey, 80% of Americans still don't know the recommended amount of exercise. So why do you think that's the case?
Well, I think there are several reasons for that, Robin. I think exercise is one of these things we think, well, I know how to exercise. I can walk, I can do whatever I want, but we really don't know that there's a threshold to gain the benefit. And what we're looking at here is a minimum of 30 minutes per day, 5 days a week, totaling up to at least 150 minutes of exercise in a week would be beneficial. Now, a lot of us think that on our jobs, I'm standing, I'm walking, I'm moving on the job on a regular basis, and that's the activity that's necessary. But in today's society, so many of our jobs have become more sedentary that we're not getting the appropriate amount of exercise.
Okay, so 30 minutes a day should be good. We all should be able to do that for sure. So what is the #1 misconception, though, among Americans when it comes to exercise? Is it that they think they could just, walk around the office, or what is it?
Yeah. So Robin, I think it's an issue of some people think that they have to exercise more vigorously than what is really necessary, and some people think that a little bit of exercise at a very modest level is going to give them the benefits. And really what we're looking for is something that's moderate across the board. Now, that's going to vary from person to person. So for somebody who hasn't been exercising, maybe a casual or vigorous walk would be appropriate. For somebody else, they may need to move to swimming. They may prefer to do a cycle. Some people may need to go to a jog to get the moderate intensity. So it varies from person to person as to what that moderate level is.
All right. Also in the survey, it discovered that the majority of Americans know that cardiac rehab can reduce mortality rates, but only 25% of eligible patients participate. So why do you think that is?
Yes. So, Robin, we're seeing a gross discrepancy between the benefits of the exercise in cardiac rehabilitation, or the benefits of a cardiac rehabilitation program, and the utilization of that service. As you said, only about 25% of eligible individuals are getting enrolled in a cardiac rehab program. And a lot of that may be the fact that they think after they've had their bypass surgery, after they've had the stent put in, that they're cured from heart disease. But these are really just treatments for heart disease. And what's essential for reducing the risk going forward is to look at the risk factors that each individual has and getting a plan set up that's going to address those risk factors. And across the board, exercise is included in that plan.
All right, Dr. Blackburn, where can viewers go to get more information? We talked about a lot of important stuff today.
Certainly, Robin. So if you're looking for more information, I'm going to suggest you go to clevelandclinic.org/loveyourheart.
All right, sounds good. Thank you so much for being with us.
Thank you, Robin.